We will be performing the neurological exam checklist. The PA would first knock on the door, introduce herself, and wash her hands. She would then test for the mini mental status exam. The first thing, she would notice if the patient is conscious, and she would orient with 3 different questions.
Could you tell me your name?
Daniel.
And where we are right now?
Campbell.
And what day of the week is it?
Wednesday.
Okay.
Then she would ask the patient to remember 3 objects.
Okay, could you just repeat these 3 objects and then remember them, okay?
Okay.
Light, paper, pencil.
Light, paper, pencil.
Then she would ask the patient to start at 100 and count backwards by 7s.
Could you start from 100 and count backwards by 7s?
Sure. 100, 93, 86.
Okay, that's good.
And then recall the objects.
You recall the objects I asked you to remember.
Light, paper, pencil.
She would then show him an object and then repeat a sentence, and then he should follow the command.
Okay, could you tell me what this object is?
Say pencil.
Do you take this in your right hand, place it in your left hand, and hand it back to me? And then repeat this sentence. The sky is blue and the grass is green.
The sky is blue and the grass is green.
The PA would now check the cranial nerves, beginning with cranial nerve 1, olfactory. She would first ask the patient to close their eyes and sniff the content of the container before them, and ask what they are smelling.
Coffee.
She would then check cranial nerve 2, and she would ask the patient to occlude one eye and read the last line from left to right, occlude the other eye and read from right to left, and then read with both eyes.
937826 628739.
She would then check the visual fields, asking the patient to indicate when they see her hand movements. She would then check the fundoscopic test exam for the optic disc and look for the red reflex, the cone of light, and the optic disc,
You can look straight ahead for me.
and the retinal vessels. She would then check the cranial nerve 3, 4, and 6. Starting with cranial nerve 3, she would check for pupil constriction. She would check the pupil reaction to light, both direct and consensual. She would then check the cranial nerve 6 and 4, trochlear and abducens, with the extraocular motor exam.
Follow my pencil with your eyes.
And she would pause for nystagmus. She would then check for cranial nerve 5, the trigeminal nerve, and she would ask the patient to move their jaw up, down, and sideways. To check the sensory of the trigeminal nerve, she would lightly touch the patient on the forehead, cheek, and jaw symmetrically, and ask if they felt her touch in the 3 locations.
Yes.
Okay.
She would then check the facial nerve, cranial nerve 7, and ask the patient to raise their eyebrows, close their eyes tight, smile, frown, and puff out their cheeks. She would now check for the acoustic nerve, and she would test with the whisper test.
Close your one ear and repeat what I whisper.
1, 2, 3.
And the other side.
I love soccer.
She would now perform the Weber test with her tuning fork to test for the cranial nerve 8.
Did you hear this on both ears?
Yes.
Okay.
And now she would perform the Rhine test to observe if air conduction was greater than the bone conduction.
Tell me when the sound disappears.
It disappeared?
Do you still hear it?
Yes. It disappeared? I
Still
can
hear
hear
it? Okay.
She will now check for the cranial nerve 10, the vagus, by asking the patient to say I or ah using her pen light to inspect the uvula and tonsil movement.
Ah.
And she would now check for the glossopharyngeal, asking the patient to swallow or gag.
Okay.
And then she would check for the hypoglossal, asking them to stick their tongue out and move it around. And then she would check for the spinal accessory nerve, asking the patient to shrug their shoulders and then turn their head against the palm of her hand on both sides. And she will now check for the hypoglossal, cranial nerve 12, asking the patient to stick out their tongue and move it from right to left. She will now check cranial nerve 11, the spinal accessory, asking the patient to shrug their shoulders and turning their head against resistance. The PA will now check for coordinating, beginning with rapid alternating motion. The patient will supinate and pronate and tap their feet. The PA will now have the patient touch their nose, and then her finger, and then back to his nose. And then she will ask him to move their heel along their shin for both legs. The PA will now check for gait and balance, beginning with tandem gait. The patient will walk normally, and then will walk heel to toe, and then will walk on their tippy toes, and then will walk on their heel. The PA will now perform the Romberg test, asking the patient to stand still with their eyes closed. She will watch for stability and balance issues. The PA will now perform the pronator drift test, and she will ask the patient to stretch both. Check for the sensory, checking the sensation of light touch throughout the dermatomes, beginning with the shoulders, C5, the thumbs, C6, the middle fingers, C7, the pinky fingers, C8, inner forearm, T1, lateral thighs, L3, medial ankle, L4, first interdigital space, L5, and the lateral ankle, S1. The PA will now check for stereognosis. Holding a pen in her hand, she'll ask the patient to close their eyes, and the patient will tell what the item is.
Pen.
The PA will now check for graphesthesia. Asking the patient to close their eyes, she'll write the number on
R.
the patient's palm, and the patient will repeat what the number is.
1.
The PA will now perform 2-point discrimination. With the patient's eyes closed, the PA will touch the fingers in either 2 or
2.
1 points.
2. 1. 1. 2.
The PA will now check for the thumb and big toe for proprioception. Both sides will be checked.
Down. Down.
The PA would check for vibration on the big toe and thumb, checking on both sides. And the patient will verbalize if they felt the
Yes.
vibration.
Stopped. Yes. Stopped.
Now test for strength, first inspecting and palpating for muscle mass, tone, and innervation. She will now test the upper extremities, the biceps flexion, C5 and C6, triceps extension, C6 and through 6-8, wrist extension, C6, 7, and 8, grip, C7, 8, and T1, finger abduction, C8 and T1, thumb opposition, C8 and T1.
Yep.
The PA will now move to the lower extremities, testing for hip abduction, L4, 5, and S1, hip adduction, L2, 3, and 4, hip flexion, L2, 3, and 4, hip extension, S1, knee extension, L2, 3, and 4, knee flexion, L4, 5, S1, and 2, ankle plantar flexion, S1, and ankle dorsiflexion, L4 and 5. The PA will now check the reflexes, beginning with the biceps, C5, C6, moving on to the triceps, C6, C7, then the brachioradialis, C5, C7, and the patellar, L2, 3, and 4, Achilles, S1, and plantar, L5, S1. Making sure that she did this on both sides.